By the time you're exploring rotator cuff repair surgery, you'll likely have already spoken to your doctor or seen a physio who have advised you to speak to a shoulder specialist regarding your shoulder pain to discuss the various surgical treatment options. In this video, I'm going to do a quick run through the anatomy of the shoulder, what to expect when having rotator cuff repair surgery, and answer some of the common questions that I get around preparation, recovery times, and the healing process. I'm Andrew Chambler, consultant orthopaedic surgeon and shoulder specialist at the Bath Clinic, part of Circle Health Group, the largest private healthcare provider in the UK, with over 50 hospitals across the country. It's worth mentioning that you don't always need surgery to relieve damaged rotator cuff pain. Alternative ways of supporting your shoulder through physiotherapy, having steroid injections to reduce inflammation, or simply taking pain relief and reducing any heavy lifting you're doing can be effective for some people to be able to heal in some situations. If you try these more conservative measures and they don't work, it could be that surgery to repair your torn tendon will give you the better outcome. Rotator cuff repair is an effective treatment for people with damage to any of the muscles and tendons in the shoulder that control the movement. It can be a big decision to have surgery, but if your injury is particularly bad, then it's often a necessary option and one that's done sooner rather than later. Success rates are high, with over 90% of patients satisfied with their results. Risks, which are always present in surgery, are very low, with significant problems well under 1%. Do remember that booking a consultation and talking to a surgeon about rotator cuff repair surgery doesn't mean you're committing to having the treatment. It's simply a chance to understand the various options available to you. If you're not yet sure what's causing your shoulder pain, we have another video on the channel which breaks down in more detail the common causes of shoulder pain and the different symptoms you might be feeling with each of them. The shoulder is a fairly complex joint, so let's look at some basic anatomy to help you. The main area is the ball and socket joint here, which gives rise to a great range of movement of the shoulder, and this movement is done by the rotator cuff muscles which come from the shoulder blade. They come across from the front, over the top, and even around the back here. The issue is that they have to pass underneath this bony ligament arch, and when doing that they can cause scuffing, which allows some inflammation and pain, and enough of that can lead to a rotator cuff tear. These muscles and ligaments in the rotator cuff can tear by having an accident, through a fall, wrenching of an arm, or even lifting something too heavy. Or as we age, the rotator cuff tendon can wear and degrade, becoming weak and increasingly prone to rupture or injury. If the rotator cuff tendons or muscles tear, you'll find it very difficult and often very painful to lift or rotate the arm away from the body with the same range of motion as you did before the injury. Pain at night is also very common, often radiating down the arm. The aim of surgery is to reduce your pain and get your shoulder functioning back the way it should, so you can go about living your life normally again. The surgery is usually performed arthroscopically, or more commonly known as a keyhole technique, where the camera is placed inside the joint for the surgeons to see. However, sometimes it may be done as an open procedure or a combination of the two, called a mini-open repair. Where possible, we'll aim to do it with the smallest incisions possible, which results in less pain for you afterwards and means your period of recovery is hopefully shorter. The rotator cuff repair itself involves stitching the torn tendon back to where it should be connected at the top of the arm bone, the humerus, using sutures and bone anchors. Advances in the ways we can repair tendons are getting more and more sophisticated. Here at Circle Health Group, mechanical repair can also be supported biologically using new collagen implants which stimulate the tendon itself to heal. Your surgeon may perform other procedures if needed in the shoulder alongside your rotator cuff repair in order to maximise your chances of the best outcome. These include making more space for the tendons overall, something called a decompression, addressing any damage to the arthritis in the small joint at the top of the shoulder, or even releasing the main shoulder joint itself if it has become stiff due to the disuse. You won't feel anything during your procedure. You meet your anaesthetist before the operation, and the whole operation will be done using a general anaesthetic. so being asleep for the whole process means that you won't feel any pain. Before the anaesthetist puts you to sleep, they will guide in a long-acting local anaesthetic at the top of your shoulder, which makes your whole arm numb for several hours afterwards. This helps with the post-operative discomfort. It is important to take painkillers before this local anaesthetic wears off, so the transition isn't too painful. Recovery from shoulder surgery requires your commitment and dedication to make sure your shoulder recovers as best as possible. You're signing up to a full-time job of healing and exercise, and we're going to explain why. Directly after the surgery, there is going to be some pain and swelling. Your recovery time will depend on all sorts of factors, like the size of the tear, how long you've had the damage in the tendon, and how diligently you stick to the exercise and stretching programs set out by your physiotherapist. Immediately after surgery, you'll feel some numbness in your shoulder as the anaesthetic wears off. That will last around 24 hours. You'll have your arm in a sling, which makes moving around a lot easier. You'll feel some pain and discomfort in your shoulder for at least a few days after surgery. This can be managed with traditional painkillers such as paracetamol or ibuprofen. Straight away, your physiotherapist will show you exercises that will keep swelling down and avoid stiffness. You'll usually be able to leave the hospital and return home the same day. And of course, we'll make sure you have all the tools and information to continue these exercises at home. In the weeks after surgery, you'll meet up with the physios regularly, and then those visits will spread out over time as you do more and more of this on your own. At 3 to 6 weeks after your surgery, you will gradually wean out of your sling and start the formal rehabilitation program with your physiotherapist. At about 6 weeks, you can usually return to work. At this stage, depending on the type of work that you do. Most people with office jobs are able to go back into work, but if you have a manual or physical job, you will probably need more time off. We'll talk you through all the factors related to your lifestyle and how best to recover and heal. Each patient's recovery is different and dependent on the extent of the damage to the tendons, how they were repaired, and your lifestyle and physical goals. A lot of people ask when they'll be able to drive or play sports again. This will all depend on the progress of your recovery. You absolutely shouldn't drive or play sports until your consultant is happy that the shoulder is strong enough to be able to withstand it. You don't want to damage or delay the healing. You should also ask your car insurance provider, as they may have specific rules about when you can drive after surgery. For most people, if recovery progresses well, you'll be able to return to doing more physical activities like sports in the gym within about 4 to 6 months. About 8 to 12 weeks after surgery, you should be well on the way to a full recovery and be able to go through a normal day with ease. A full recovery will probably take you more like 6 to 12 months, and throughout this time, you should continue to look after and strengthen your shoulder with physio and avoiding any damage. If you're looking for information on the best types of exercises for recovery, we have a video on our channel where one of our specialist physiotherapists talks through the best exercises for a good recovery from shoulder surgery. So, that was a brief run through of what to expect with rotator cuff repair surgery and an idea of what the current advances are in the ways we can help you get back to using your shoulder normally. If you want to come and see me for a consultation to talk through your options for the rotator cuff repair surgery or any other shoulder problem, you can book online via the link in the description below. Or alternatively, search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below, as we'd love to hear from you. Otherwise, thanks for watching.